up, we're going to talk about something very important, palliative and hospice care. This is about making sure cancer patients, no matter what stage they're in, are comfortable and taken care of. It's not just about treating the disease, but also about helping people live well, even if they're still undergoing treatment or in the later stages of their journey. I'd like to call on our moderator on stage so she can introduce herself and our speakers.
Hello. Nice to be here. I'm happy to see friends and survivors. I will not tell you about my survival techniques. But can I have a tissue? Because I'm going to talk about my husband who passed away with stage 4 lung cancer. And that was the first time I experienced how it is to be taking care of him and converting one of my rooms in my house into a hospice place. So I was familiar, but I was telling Cara, why am I going to talk about this? This is very heavy. No, tita. Okay. So, but he survived after the diagnosis and prognosis in March, and he passed away in September. So I would do the news at 10 o'clock at night, and 2 of the caregivers at home would take care of him. And my friend said, why are you doing the news? Your husband is not well. Well, you know, my husband would be very happy that I'm working, so we have some wherewithal to be able to survive. But that was my most interesting experience. So when I saw palliative and hospice, I tore down the doors from the banyo to the special room where my children used to stay and our room. Walang pintuan. Talagang pinabagsak ko, sabi ko, para wala nang binubuksan na pintuan. And at the point I was going to do that, he really fell. So, I don't know what situation it is, but I had to bring him to the hospital. So he stayed there for like a month in the ICU. And that was one situation where I said, this is an opportunity for me to take care of him. Because I've really worked so hard. I mean, Cara would know that. Worked so hard, flying in different parts of the Philippines, you know, helping and doing some kind of public service. And I said, this is, parang sinabi sa akin, this is the time you take care of him. So every time I would come home, because when he was well, he would wait for me after I do the news, and he'd open the door, the gate. Sabi ko, wag ka na mag-open ng gate. Sabi ko, yung ano na lang, hindi, gusto ko tang makita pag bumabalik ka. So I would, after I take a bath, I would just really hug him the whole time. Really, really hug him. And he didn't want me to stand up and hug him because he wanted to go to the bathroom himself. But anyway, that's I don't know if it was palliative decency, but there were some palliative nurses and a staff who went to check the room on whether they could actually do it there. Said, yeah, do it here. He doesn't want to stay in the hospital. Just do it here. But things got to be not good. So he passed away, and it was his birthday last Saturday, 76th birthday. So. And that was my experience. Anyway, so let me not bother you. But I am a survivor. But this is not for any publication. I was doing my exercises in the gym downstairs where I live. And one of the persons in the gym said, Ma'am, parang meron kayong ano dito. Yung gano'n lang. Talaga? Sabi ko gano'n. So I called the oncologist of my husband. I said, you have to see me. The girl in the gym said, I have something. So this was like 9 in the morning. And when the oncologist doctor saw me, talagang all the treatments that she could muster between that time that she felt it and by the time about 12 o'clock when I called my youngest child to see me, I mean, it was what it was. But what made it easier for me was I was not at all afraid because it ran in my family from what I'm told. My mom, my grandmother, maternal side, all had. And so I went straight. But there was one thing that they did with the breast surgeon. They got a biopsy of what it was. And this was on December 8th, and sent it to Amsterdam. Amsterdam. I don't know if you're familiar. If I'm talking nonsense here, you tell me, says Palma, you're talking nonsense. No, but I like to share. I have 5 minutes. I have 5 minutes. So sabi ko, they're going to send it. And then the doctor tells me, the onco tells me, and the girl who took it, sabi niya, we'll know what it is a month from now. Okay? And a month from now, they learn the pattern of this cell. Meron na palang ganon. Titingnan nila kung how long that cell, I don't know if the word metastasized, because I also had a PET scan and there was nothing there. So tinitingnan nila, if you don't, because I said, when I found out that it was C1, stage 1, sabi ko, if I don't do chemo, sabi niya, how long will I live? And this was in front of my 3 boys. Sabi ko, how long will I live if I don't chemo? If you don't, sabi niya, 4 years' time, you'll be stage something. Okay, sabi ko, I can die. No, really, I can die. And my children said, Mom, what are you saying? I said, 3-4 years? And that was going to be, you're going to tell me that, was I crazy? No. I was just ready, sabi ko. If not, sabi ko, I can die. So, and then we went through the whole sessions with when they got hold of the biopsy, and they knew exactly what kind of medicine to give you. Have you heard about this? So I will not tell you anymore. No more na. My version is so ordinary, you'll be so bored. So when I found out I had to have chemo, so I said, if my hair is going to fall, I'm not going to tolerate it. So I called the barber. Nagpakalbo ako. Kalbo talaga. So I would go to church, and I never even told my relatives that I was going through. So they would see me in these nice hats of, that movie Forevermore? Na sinusuot ni Lisa Soberano, yung ganon. Sabi ng pamangkin ko, Tita, what's happening to you? Yes, sabi ko, I am. Sabi niya, but I don't want to bother any one of you, sabi ko. So I'm okay. So when I was okay, I was so happy. So my first chemo, I said, I will do it on my birthday. Yeah, do it on my birthday. Tell me if I'm to shut up na, ha? I'm on television. I know when to shut up. 2 minutes, okay. So, first chemo. Sabi ko, I want to do it. Sabi ko, do sa March 29, okay? The celebration of the New People's Army. Okay. I didn't know. I want to do it like that. So, okay, sabi niya, so we'll do it. So, preparation, they put you in the suite, and they put all of these things. And so, after that, I didn't feel anything. I was so light. I felt so relieved. So, after siguro, I checked in about 8, mga 10:30, tapos na ako. Nahulog na lahat yung tapos sinurok-turok lang dito, medyo ninenervyos yung medtech. Sabi ko, Iha, sabi ko, wag kang ninenervyusin, tawagan mo na lang yung boss mo. Sabi ko, gano'n, para matapos na tayo. So I made her felt good. Diba? So after that, I went home. So nung dumating na ako sa bahay, sabi ko, I'm going, sabi niya. So I was going to go to an event that my friends organized on my birthday. And I didn't tell them it was chemo I had. So I was already in the car and I was going to go. Sabi ng anak ko, eldest, Ma, where are you going? Sabi ko, my friends who I work with in Sagip and in Banday Bata are giving me a party. They've already organized that, Mom, you're not going anywhere. Sabi ko, but I feel good. I didn't feel anything. So I violated his order. I went to to Fanny Serrano, this is the last. Fanny Serrano. And then ang ganda-ganda pala ng tubo ng buhok after you become bald. So I was like, Halle Berry? Sino yung Halle Berry? Maganda ako. So sa, Asa ako? Talaga asa ka? So sabi ko sa kanila, pare, sabi ko all of these were men. These were the people I worked with, but all men. And we've worked closely up in the mountains, down in the rivers, and choppers up and down. And I said, I can't go because my children don't want me to go. So I went to the parlor. 10 seconds. I went to the parlor and told them, sabi ko, kailangan ko ba ng wig? That's when they decided to get me a wig. Anyway, thank you very much. That's my little story. But I am 9 years or 10 years. If it's okay, then it's okay. But if it's not okay, then it's okay. Nothing. Can I walk? No, this is another issue, I had a graft because I threw soup, cocido, boiling broth, and oil on my thigh. That's why I can't walk. And then I couldn't bring the therapist, 1 minute. I couldn't bring the therapist to my unit, so wala akong ginawa. I copied all the exercises, puro mga lalaki yung mali pala. Okay, so I'm here to moderate or to whatever it is that I will do, is to introduce the experts. I am not an expert. I am just a storyteller. To understand palliative and hospice care. I think alam na nyo yun, di ba? Okay, so why are we even having this session? Sorry. To dispel our fears about encountering issues as we go along. But there is a better way, I think, to do it. If we're missing some points, then let's listen, and I will listen. And they will help us understand. So I have to read because I want to introduce the resource persons who will stay here. The President of the National Hospice and Palliative Care Council of the Philippines. She is a family medicine and palliative medicine specialist currently affiliated with the Asian Hospital and Medical Center, where she also serves as Vice Chairman of the Department of Occupational and Family Medicine. In addition to her palliative medicine practice, she's mainly involved with hospice care, training and advocacy, and cancer and grief programs. May I call on stage Dr. Mae Corvera. Hi. We have the Executive Director of the National Hospice and Palliative Care Council of the Philippines. She is also the founder and immediate past president of the Philippine Alliance of Patients Organization. She is a co-founder of the KITE Foundation. This is very familiar, which has been addressing the needs of children with cancer and other chronic illnesses since 1992. She is also an Ashoka Fellow. Ashoka is a US-based global organization that recognizes outstanding achievements of social innovators. So Girlie, come here now. Okay, so we will begin with Dr. Mae. I like. So I was asking her, how many slides does she have? 48. What?
In 15 minutes.
48 slides in 15 minutes. She'll do it. Okay? So listen, listen.
Okay, the challenge for 48 slides. But Ma'am Tina, I could have listened to you all morning, right? I mean, you could have. But again, it's just a privilege to be here. Talaga every time I'm with ICANSERVE in this group of empowered conquerors for cancer, the energy is, indescribable, and I'm just so grateful. And I know some of my colleagues and advocates for breast cancer here from Project Pink and from Boobs. I think Betty is Betty here? There you are. She was doing Zumba last night, I think until 10 p.m. For awareness. And I said, aren't you going tomorrow early? Yes, Doc, I'll be there tomorrow early. She has been an inspiration to many. And I'd also like to see, again, because I heard yesterday I was here, there are stage 4 cancer conquerors also here. Can I see a hand? Raise of hands. Ma'am, talagang yun. No words can, I mean, that's my message altogether. I don't have to speak na. Because seeing stage 4 up and living and just continue conquering and inspiring, that's what palliative and hospice care is all about. It's not quality of death. It's quality of life until the last minute. And I am here this morning just to again introduce, because this is something that we really want to make sure that it's part of the NICA implementation, the National Integrated Cancer Control Act, because it is part of cancer care, and our goal here is to upstream. When we say upstream, early we refer for supportive care, for palliative care, and even for hospice care. My closest patient, who also was stage 4, was my mother-in-law, and she was stage 4, but colorectal, for 10 years. At the age of 75. She was an elderly. Of course, her immune system at that stage of life is also not strong anymore, but she conquered it stage 4 for 10 years. And it went to her liver, but until she celebrated her 85th birthday, September 29, she was up and enjoying her 85th birthday. She had one in Iloilo, that's where we're from. She had one here. The next month, she decided to rest. God had plans, but it was a beautiful last month, okay? But for this particular sharing, okay, my time, I promised myself that I would also dedicate this short talk to another friend of mine, because she particularly had breast cancer. And you see the phases here: supportive, palliative, and hospice care. Itong friend of mine, very close, went from diagnosis to hospice just recently, in less than 2 months. And this is why I'm dedicating this talk for her and her story, because I don't want her journey to go to waste. And so I'll just share some of the texts that we had. July 16. Hi, Doc May. Sobrang busy lang sa work. She is a high executive in a bank. I have to tell you, I have na breast mass. July 16. July 30. So we talked. July 30, she had pain, so she messaged again. Hi, May, please advise when I can call. So that at that point, I said, okay, there's pain. I advised for her to check in with a palliative medicine specialist, along with her oncologist, of course. July 30 po yun. Uh, August 1, 2 days after. Hi, Doc May. Here, confined. There's fluid in my lungs. Please pray. Successful procedure. Please pray for a successful procedure. Thank you. Same day, she had to go to the ICU because of the fluid, but it was removed. August 1 po yun. August 12, less than 2 weeks. Hi, Doc May. No visitors allowed, so not to compromise my immune system. May konting hingal pa din. So she, made kwento. Please continue to pray for good results. Thank you so much for your love. September 2, back in the hospital. Discharged already last week, but abon, there's water again. Thank you so much for prayers. September 4, just 2 days after, need more support. Still have fluid. Chemo tomorrow. So on that day, I said, okay, I shared this poem to her. Just for, I think maybe some of you have heard it. Cancer is so limited. Narinig niyo na po yan. It's a beautiful poem, but actually the author is unknown. I think I haven't found out who the real one is, but cancer is so limited. So I shinare ko to sa kanya, and I'll share it with you. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. Tama ba? It cannot eat away peace. It cannot destroy confidence. Cancer cannot kill friendship. Right? Cancer cannot shut out memories, beautiful memories. Cancer cannot silence courage. It cannot reduce eternal life. It cannot quench the spirit, and that's what I'm seeing here today. Cancer is so limited, it's not quenching any of yours. I shared this with her because I felt it was at a time that maybe, palliative care, this was in a nutshell, that she needs to know that that's what we're fighting for. We're showing that cancer is limited. The last text I will read is now from her husband, okay, September 13. And he was the one who said, one day at a time. So it's that one day at a time phase. And she, under the care of palliative, finally, because it was referred later na, because maybe in her last week, but then it was a peaceful farewell. But I dedicate this information, whatever, I will share it to her. And that's showing you the spectrum. Supportive care, we heard about it yesterday. So like she went through supportive care because she did have one phase of chemo. Of course, there were side effects. And that's mainly what supportive care attends to, the side effects of treatment. And it can come earlier. Mostly, it's referred as supportive care before palliative care, which now attends to more severe health-related suffering. Kung tanungin kayo kung ano talaga ang definition ng palliative care, siguro dalawang lang tandaan nyo. It addresses severe health-related suffering, any form, not just physical, emotional, okay, social, spiritual. But of course, primary trabaho namin is to address your physical suffering, your pain. So when it gets to that level, palliative care is called in. But the sad thing is, when it gets to hospice, mas madalas dun pa kami nasabihan. Hospice is when wala nang cure. But care is of importance, utmost importance. So the quote I share often is, when the opportunities for cure decrease, the opportunities for care increase and must increase. And that is where hospice care comes in. Okay? And palliative care, another phrase para ma-define ng palliative care, anong goal ng palliative care? Quality of life. So when you're diagnosed with cancer, the quality of your life on day one, I tell you, you already feel the decline, right? Emotionally, lalo. So the palliative care approach must be applied na. Kahit kaninong doctor, kahit hindi siya specialista sa palliative, that palliative approach by the nurse, by the doctor, should be automatic. And that's something we're advocating for, that all healthcare workers know the palliative care approach. So our agenda for today, for the next 10 minutes I have, is just to run through this. What is it again? What's palliative care? Why is it important? Why is access important? Who provides it? When do we shift to hospice care, which I just actually said, and where can we find it? Palliative care providers in the Philippines. And how do we work together, tayo lahat, toward this goal of supportive palliative and hospice care for all. Kahapon pa natin narinig na sana all. Okay, so this is basically the WHO definition, which I won't go through in word by word. You can see here it's a whole person care. Okay, physical, psychosocial, and spiritual. Goal is quality of life. The person we care for is not just the patient, like you heard, it's the whole family. And it's associated with these problems that come with cancer or any other life-threatening illness. This is the model of palliative care. This is actually the new one because before it started when wala nang cure. Now we are seeing this new model wherein supportive and palliative care should come in, at least the approach, upon diagnosis. And it even extends to the time of bereavement for the family. So it's a triangle, okay? So remember, that's the spectrum for palliative care. Next, this is just another model where you can see early, mid, and late, no? So you can see that palliative care can already come in. So that's just another clearer diagram. Okay, the importance, this is where I'm just gonna breeze through. Importante siya dahil noon pa, almost 30 years ago, pa pinag-uusapan dito sa Pilipinas. Okay, so at 1995, there was already movements. There was the first National Hospice Convention held by the Philippine Cancer Society. The Philippine Cancer Society is one of the main movers na nagdala ng palliative care dito sa ating bansa. So you can see 30 years in the making. So this one, I'll just breeze through. Noong 2005, there was actually a presidential proclamation, no? Sa time ni GMA, that declaring it was October of each year to celebrate this, para ma-disseminate. So again, almost 20 years ago pa yon, pero hindi pa alam pa rin ng majority, diba? 2012, we were just fortunate to have by then, so I was in PGH as a young family medicine specialist. Patients were referred to us to be sent home. May mawala na kami magagawa dyan sa pasyente, kailangan na namin yung kama. So our job as family med was to do a counseling with the family, and we did home care. And then in 2003, 2004, fellowship specialty training was brought into PGH, and I was the second batch of trainees for that specialization, that subspecialization. But it was still 7 years after that, the Society now for Palliative Medicine was formed. So if dalawa lang kami noon sa time ko, or tatlo, we now have 75 good specialists. And yeah, but kulang pa, di ba? Kulang pa because some of them would come from Mindanao, train PGH, and go back to Mindanao. We have some train PGH, go to Tawi-Tawi, covering that area. Some in Eastern Visayas. Pero isa, dalawa pa rin. So we're seeing how can we integrate this sa lahat na doctors na alam nila, kahit hindi pa sila specialista. So we formed that society for that purpose, to be able to lead as trainers. And then, of course, DOH responded to a headline, which is in Star at 2015, which gave the news that the Philippines was one of the worst countries to die in. That was a headline in Star. It was because we were measured by a quality of death index by a study done in Singapore among 83 countries. Because of our lack of programs, government support, lack of professionals, lack of information dissemination, we were third to the last. The two last were Bangladesh and Iraq. That was 2015. Kaya ang kagandahan po nun, DOH responded with a administrative order na nagsabi na kailangan may programa yung gobyerno for palliative and hospice care. So that was a national, an administrative order then. And it was started, there was training budget downloaded to government hospitals for that training. A good almost 9 years ago. So we've come quite a long distance, but this just shows you that it is a must to be integrated into the country's health system. Dapat alam ng lahat na tao na may ganito. So that's population-based care when they say that. But then, of course, yung capacity building has to be done. Kasi kahit i-cover man ng PhilHealth yun, kung wala naman magbibigay ng care. So that policy was made in order to do that, but that was 9 years ago. And we're still advocating this fact, the importance of it, integrating it into all institutions. So this, kasama na yung supportive care na sinasabi. Dapat lahat na hospitals natin, government and private, should have this program attached to any cancer center. Again, importance. Finally, in the Universal Healthcare Law, palliative care was included. In the NICA law, palliative care was also included. It was clearly stated that it's part of cancer care, it's part of primary care. How did this happen? At that time, I was president of the society, and then Dr. Rachel Rosario, maybe you know her, PCS, and I and Dr. Agnes Bausa, we lobbied for a separate law for palliative and hospice care then. But then the rock stars then were the NICA and the UHC. So we were kindly advised to go to Senator Hercito and present that. And I believe it helped, make sure it was included in the UHC. So much thanks also to Senator Angara for guiding us during that time. At least it was a big step forward. So ito lang, these are just the ones I'll slide through. It's in the NICA. I just showed you its place in the NICA, all those highlights. Their palliative care is there. Just in summary, what's the importance? Palliative care includes improves quality of life, symptom management. Cancer pain is a totally different topic we should take up maybe for a whole morning. Holistic care, whole person care, and it has proven to be cost effective, even for hospitals. Because a lot of indecision, a lot of futile care, a lot of continuity of care can be done in the home once there's a supportive team from the hospital. Hindi kailangan gumastos na as inpatient, so cost effective. And then of course, towards those latter stages, it respects the patient's wishes, reduces healthcare disparities. Na dapat talaga sana all. Okay, so ito lang, breezing through all of the work we did during the pandemic, yung mga specialists plus alongside our colleagues, and DOH supported na this one. It is the National Manual for Palliative and Hospice Care. We worked on this throughout the pandemic, and now it's published and being disseminated. So this is where I want us to come in and pay attention to. And this is something I learned. Okay, it's something I learned when I heard the term in the campaign of compassionate communities. Okay, now the rationale behind this campaign is the fact that studies have shown that formal caregiving, yung doctors, nurses, yung time natin with formal caregivers is just 10% of our hours. Let's say of our week or of our month, 10% lang po. Okay? What about the other 90%? Who is giving the care? Informal caregivers. You heard from Ma'am Tina. 90%. So what are we doing with this 90%? How are we supporting or giving information and building capacity and empowering this 90% who takes care of our patients, us, 90% of our time? We need a community to do this. We need to empower direct caregivers, family, neighbors, schools, workplace, churches, because that's where we live and thrive, our patients 90% of the time. Apart from the fact that our government cannot do this alone. So what's the implication of this 90% reality? Prevention and harm reduction of the comorbidities. Itong medical term to, comorbidities. Maliban sa diagnosis mo, mayroon ka pang ibang sakit or naramdaman. Ano yun? Anxiety, depression, loneliness, social isolation, stigma, social rejection, lost school days, lost work days, and sadly, there are some who really succumb. Suicide is actually now a mortality. So the 90% has to be there, but then how? They don't know how. We need to build capacity among us to be there for our friend. Help them navigate this system. So going to where we can find palliative and hospice care, ito pa lang po, yung naka-highlight sa mapa ng Pilipinas. You'll have a copy naman of these slides. So the blue is institutionalized. The yellow is meron dyan specialista pero walang programa yung hospital. Those are government hospitals pa lang po. But then, no, we've worked hard and long to get them in private hospitals as well. So a lot of our specialists are practicing in more than 3 hospitals. 1 government from 8 to 5, and in a private or in the home from 5 to, you could say, 2 a.m. in the morning, even for some who go to the homes. Private hospitals, we're happy that we do have it now in our major hospitals here in the metro, but what about those places far-fetched? Who does home care for them? Okay, so how do we proceed towards access for all? We work with the existing framework. Mayroon ng Biblia, dapat yung times up. Prioritize capacity building, learn from best practices, build compassionate communities, and keep on keeping on. I think this can actually be my last slide. We just keep on keeping on together. And that's how it's supposed to be, that all doctors and healthcare professionals should know the palliative care approach. Some can go in further training for general, and then there are some specialists who we hope to grow framework na lang to, okay? So these are all the work. This one, maybe I'll save for this afternoon session, just shows how much governments in developed countries cover for palliative and hospice care. I don't even know if I show this now, but maybe I'll just keep that as my notes for later when we talk to government. Essential components, okay, so it is already, okay, in other countries. So I'll skim through that. And you know we cost less here. Doesn't take it, whatever their figures are, we could do the same for 70% off, okay? But we're not doing it yet. Best practices, PGH, SPMC in the South, Manila, Mindanao, JBL. So these are just hospitals. Makati Med has, Asian Hospital has, Medical City has, NGOs. Okay, sorry. Okay. And then that's in our city of Muntinlupa. There's an ordinance already for community-based palliative care. So unti-unti, no, nagpo-progreso po. And that's just highlighting the compassionate community and the author, Professor Alan Kelleher. We can read more about him. And that's just the charter that we could lobby for compassionate communities. And that's how distributed compassionate communities are around the world already. They're practicing the principles. And we just have to keep on keeping on. That's the number 78, the ranking. But the good news is, in 2021, we got up. Number 38 na tayo. We were as another study. So, you know, this is all because of teamwork, advocacy, your voice, okay? So we're improving. So never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has, Margaret Mead says, and I say, and we all say. Okay? So thank you so much.
Now it's your turn, Girlie.
Okay, so good morning, everyone. So thank you to my boss, Doc Mae Corvera, for presenting a very comprehensive presentation on supportive palliative and hospice care in the Philippines. I would like to share with you my personal experience on how supportive palliative and hospice care helped our family cope with the sickness and eventual passing of my papa, Attorney Ramon T. Garcia. Maybe we could show my one slide. I just have one slide. Let me give you a little background about my papa. Attorney Ramon T. Garcia was appointed chairperson of the Asset Privatization Trust during the time of President Corazon Aquino. He also became chairman of Meralco and president of the Philippine Stock Exchange. After his government service, my papa went back to being a stockbroker at his own company, RTG and Company. My papa was one of the prime movers in forming the senior club at Bel Air, Makati Village. Together with his group mates, who called themselves the Hungry Boys, because they love to eat out, the seniors would meet once a week at the Barangay Bel Air function room. The Bel Air seniors would have guest speakers from the medical field, arts, and the like. They even offered computer and Spanish classes. I know this because I was in charge of setting up the laptop and the guest PowerPoint presentations. They would also have Lakbay Aral once a year where the seniors would go out of town. I remember once they went to Calamba to see Jose Rizal's house. What my papa and the Hungry Boys formed was a community of seniors who took care of each other. When one of the seniors gets sick, they would visit their homes to cheer them up, or they would make sure a lay minister visited to offer Holy Communion. In 2013, my papa was told by his doctors he had a small growth on his liver. There was nothing to worry about at that time, but the doctors wanted to monitor its growth. My papa knew about supportive, palliative, and hospice care because we would often discuss about what I did in CAITH, and he was even a volunteer during the early years of Hospice Philippines. He often told me and my siblings that should the time come, he wanted to die at home and not in the hospital. It was in December 2013 when my papa decided to write his living will. He wrote on his living will that should the time come he becomes incapacitated, he preferred no heroic measures be done to prolong his life. And when he died, he preferred to be cremated right away, and after 3 days' wake, that he be buried beside my mama. I was the designated person to execute this will. It was at the latter part of 2016 when my papa's health started to deteriorate. We would be in and out of the hospital, and it was then that my sister and I sought out the palliative care specialist in the hospital, who happened to be Dr. Joey Hoson. Dr. Joey Hoson, who is now the president of the Philippine Society of Hospice and Palliative Medicine. Dr. Joey then visited my dad in his room and gave him comfort. My papa was eventually discharged. In September 2017, after hearing Mass at Rockwell Chapel, my papa collapsed. He refused to go to the hospital. This was our signal to activate hospice care. I called Doc Joey, and she referred a team of nurses and suppliers for oxygen tanks. We borrowed my tita's hospital bed and transformed my papa's room to a comfortable hospital ward. Doc Joey and her team visited and monitored my papa's condition. It was during my papa's hospice care when we found out the best source of cheap diapers in Bangbang Market, and which mercury drug was open 24 hours a day. So my siblings took turns taking care of my papa, together with the nurses. My papa also made sure that while he was still lucid, the family's assets and finances were in order. I remember there was even a time when the bank manager went to the house to witness my papa signing the documents using his thumb mark. This was because he was already too weak to hold a pen and sign. It was in early December when my papa requested Bishop Milo Vergara to come to the house so he can receive the sacrament of penance. They spent a whole afternoon talking, after which Bishop Milo told us my papa was ready to go anytime. And so it happened. On December 18, 2017, my papa died, and me and my siblings were there by his side. Since my papa had a living will, we all knew what to do. His wishes were all fulfilled, and now he is with my mom in heaven, happy together forever. Supportive, palliative, and hospice care provided our family a better option to care for my papa. And I hope more Filipino families will have access to this kind of health care service too. Help us increase the awareness and acceptance of supportive, palliative, and hospice care. Begin with your family, your friends, neighbors, and co-workers. Together, let us build compassionate communities. Maraming salamat po.
So are there questions that you want to direct to our two resource persons, Girlie here and Mae, who focused on their two separate parang line of support? May question ba? Can I see you? Hi, what is your name? Buksan mo yung mic.
Hello? Yeah. Good morning. My name is Charity.
Charity.
Yes, as in charity sweepstakes.
I love you, I love you. Okay.
The good
Tell
side.
me what numbers you're thinking of this day. Yes. How is it?
I'm a stage 4 cancer survivor. Doc May, I was with you in Asian Hospital when you celebrated the anniversary of your Cancer Institute. I was thinking earlier, being a cancer coach, which group I will work in. But my dear friend Patricia said, wait for the session today. And I've decided to stick to palliative and hospice care. And my question is this. I'm also an end-of-life doula.
What is this?
End-of-life doula. So we help families accept and prepare. I think there's only two of us here. One is Kathy Babao and myself.
Oh.
My question is, how can we help really shift the bad press on palliative? Because from my experience, if I am talking to the families and cancer patients, once you use the word palliative, shut out. Wala na. Lag out na. Ayaw na makinig. No? And of course, the preparation of the living will only becomes a lot easier when you tell them it's an act of love when you do your living will because you are unburdening your families of decisions. That's hard. So how can we, as a community, deal with the bad press of palliative care? And now I also heard some hospice practitioners use the word supportive, which is very confusing, right? As you have stated in your beautiful slide, it's a separate phase. So how can we really help you and the advocacy of palliative care take that bad press away or bad rap?
Thank you. Charity, I need those numbers.
I'll go first. Thank you, Charity. And like we were learning about survivorship. Actually, I was learning more about survivorship care kahapon. That's why I wanted to be here. Because I feel we have to, hospice care is just one segment of survivorship care. So my thoughts now, and that's something that Ma'am Girlie and I are also working on. We heard compassionate communities. These are words that, you know, draw public, and then that's, you have a headline that's a bit more general in terms of compassion. That's one way. So the compassionate community campaign, hospice care being only part of it and not highlight. Survivorship care in the form of a survivorship program, survivorship package. If that's highlighted, if that's the headline, you know, hospice is there, but then not the headline. So I'm thinking that's maybe how we could approach this. At the same time, the providers also have to help, because it's the providers of palliative care and even the medical team, they have to be comfortable in explaining. That's why our training is not just from, well, we're working, Hospice Philippines is from ground up, but then we also need to train from top down, because our colleagues, our peers, also added to the bad press because they just say it and they refer at the end. So of course that's, but if there is upstreaming or mas early ang referral at nakikita na palliative care kahit stage 1 or 2 ako na-refer ako, because in other countries where I trained, also in Singapore, the Department of Palliative Medicine was under the National Cancer Center. Department of Palliative Medicine had outpatients, stage 1 and 2, because they were having referrals for counseling or simple pain management. But they were referred to the palliative medicine department. So I think it takes both directions. We need to build upstream the referral early, so makikita na it's not just an end-of-life referral. It's not
Yes.
equivalent to a death sentence.
Yes.
So I think we need to work on both. But I think two approaches would be to campaign for compassionate communities and to also campaign for coverage for perhaps survivorship programs or packages that actually cover throughout the whole journey, even through home care.
Yes.
Home care is a highlight actually of palliative care because sila din yung pumupunta sa bahay. But, you know, sometimes kahit stage 1 ka, hindi mo kaya pumunta because the pain is... So, you know, to put that into a headline that's more lay, understandable, and better press.
Thank you. I also want to highlight yung what you said before I just forget, siyempre chemo brain. I think it's very important for the people in the hospital because sometimes my clients would say, ang choice ko daw is curative or palliative, which is such a wrong language, right? So right there, masama na kaagad yung positioning ng palliative. It's like, is it living or dying? When in fact, like what you said, Doc Mae, you can walk in an ER, you're not a cancer patient, and palliation will be extended to you. No? So I think it's very important also because we all look up to the nurses and doctors, and when they start putting it in that language or framework, parang right off the bat na nagkakaroon na ng bad press. Sorry, ma'am. Sige pa.
Hello. Okay. My approach would be meet them where they are, show them what it is, and in the process, they will realize, ito pala yun. You label it after. Diba? Do it first, provide it, and then the labels will come after. That's it for me.
I wanted to add more information from Tina about what the government already actually has in that manual. Because in that manual for the national program, the one standard is that, and one indicator that it's integrated in the healthcare system is when we teach it to the undergrad. So palliative and hospice care is still an elective in nursing schools and medical schools. We're pushing, because even WHO sets it as an indicator for our country, how well we're doing, if it's integrated as a compulsory course among our doctors, our medicine, nursing, and even other allied healthcare professional courses. So we have to lobby with CHED to include that as a compulsory course so that our providers know how to explain it. Okay. And they would be grateful for your partnership as in your what you the death doula. I know Kathy, and we want to work with your team because that's what we need to help with the community.
Another question from our lady in pink.
Good morning po. I'm Veronica, but I'm not a saint. I'm from Hearts
Veronica,
of Hope.
but you're not
A saint.
a saint.
Yes.
Santo.
Opo.
Okay.
I'm from Hearts of Hope Society Cancer Support Group. Yeah, Ma'am Tina, please, may take this opportunity to tell you that I'm your fan. Okay? And, oo, parang kasi I feel intelligent when listening to you.
Oh my God, you were a baby or on a high chair?
No. College naman. Okay.
Thank you very much.
Thank you.
I feel good.
Yeah, Dr. Mae and of course, Ma'am Girlie, may I just ask, kasi of course we have cancer patients na who tell us that eto na yung last na chemo meds raw na pwedeng itry sa akin. After nito, wala na. If it does not work, then ano na, yung parang maghintay ka na lang, ganon. So, may we ask you, kasi we are not professionals, but of course, we need to comfort yung member namin. But sometimes, parang baka mamaya mali pa yung masabi namin, mas ma-depress. So may we ask some advice on how to approach them or comfort them? Thank you po.
First is Hospice Philippines, that's one of our projects, diba? It's really to train. So eventually, we will come up with these training modules on how you, patient groups, will be able to start, diba, this group processing, this support group modules, emotional support, etc. And I'm putting on my psychologist hat, and sometimes the first thing that you just need to do is listen, just open up, ask them, and what is really bothering them, okay? Because sometimes, like when with our kids and with our adolescents, like in Kai, they say, Ate Girlie, parang sabi, mamamatay na daw ako. Ganyan. Wala na daw pag-asa. Ganyan. Then, what I ask them is, ano yung talagang gusto mong sabihin? Ano yung talagang gusto mong malaman? Ano yung gusto mo talagang masabi? And then yung pala, ang fear niya of dying was when she dies, the daddy will continue hurting the mom. Apparently, siya pala yung buffer nung mom sa dad. Ganyan. So we had to address that. So sometimes these things, there are deeper meanings to it, but it's only in listening and really asking the right questions that you'll be able to dig deep. And it's a skill. And we will have modules for that. So stand by lang. We will be able to give these modules to you, yung how to address these kinds of questions. I hope that helps. Thank you.
Just a quick add-on. So the Department of Health has that manual, right? At the same time, there's a basic and intermediate training. The basic training can be for all advocates because that's where you will learn more about how palliative care can be done in the home, how to set up, how to prepare. So that's what we're looking forward to, that this DOH gave us that. Another thing is you can palliate in different ways, and we're taught as a specialist, it's not only about the psychosocial, because it seems like there's so much talking that is needed. That's really one of the pillars of palliation. But we're also taught how to appreciate the fact that there's palliative chemotherapy. There's palliative surgery. We were just with surgeons last night. We talked about how I learned about debulking and stenting to lessen symptoms, and to the chemo to slow down the progress. So it can control symptoms, especially of liver cancer. Palliative chemo can slow it down, the progress, and lessen the inflammatory response. That's palliation, that's palliative chemo. So be informed that palliative and hospice care can still be used and is applied in these modalities. It's not just counseling, it's not just home care. There's palliation through major interventions still. And then my mother-in-law had palliative chemo for 4 years. And that's something we have to know, right? So iba lang yung dose. Hindi na siya curative kasi hindi kaya ng katawan. Smaller doses, but yet it slows down all the inflammation, the symptoms it could cause. And that has to be guided. So we don't work alone as palliative specialists. We work still with our oncologist colleagues, our surgeons. And they also guide us when we do home care, okay, to understand. So that I just needed to also inform you of that, and that's something we want to teach them.
We need more questions.
Yeah, I have a question.
Hi.
Hi, my name is Glenda. I'm a voice
Glenda.
actor pero nakaka-nervous pala dito. Huwag ka kasi mag-picture, ate.
Ano po?
Okay, my name is Glenda. And I'm a voice-over actor pero nakaka-nervous pala tumayo
Voice
dito.
over actor? What role?
Well, I've done Jewel in the Palace. I dub for Korean novellas. Si Jang Gyum.
Okay.
Nakakatakot. Okay. Yes, ako si Jang Gyum.
Okay,
Okay po. Ang tanong ko po, well, first, I'm excited to have somebody from KITE. I've always wanted to meet somebody from KITE because in 2010, I voiced for one of your commercials. It won an award. So, wala pa ako and now I'm here too. So, ang question ko po, because we, in our group, the Pinky Town Warriors, we have a few single ladies. Pag may namamatay, nisip ko, sino nag-alaga dyan? And then it's kind of challenging for single people to go through treatment. So my question is, siguro lang for the expansion, if you have plans on expanding the scope of hospice care and palliative treatment, is if there's any help or if there's any organization or network of people that we can tap in case a single lady has to go through treatment and no one will assist her because, you know, I'm kind of in that situation. In fact, nabastos na ako sa isang government agency because I was in that seeking for financial help. And then sabi sa akin, that was 2 days after coming out of a biopsy from the hospital, so I was there. Sabi niya sa akin, di mo kay stono. Sinabihan ako hindi ko nasasabihin yung agency. Ginanon ako. Sabi ko, just because I was up and about doesn't mean I was lying. Diba? Nagganon ako because no one else would accompany me. And I was the one doing all the, you know, like documentation and pila-pila. Ngayon, iniisip ko, kung meron po tayong network, kunyari, kailangang magpunta ng hospital, magpa-chemo, baka po pwedeng, you know, somebody could offer transportation, going to the hospital and coming back, especially if you are going through chemo, di ba? You're dizzy, even if, because I did oral treatment in the past, 2 malalaking injection yon na I was not even, you know, thinking straight after. It was hard for me to call Grab. I had to ask the nurse or another patient to do it for me. I'm still not an expert on calling for, you know, a Grab ride until now. Pero it's really challenging if you're living on your own and you can't really expect a lot of people because the people who took care of me 5 years ago, they have their own lives now. Baka po pwede magkaroon tayo ng expansion or extension sa ating palliative care na merong app na need help. Transportation ba? Moral support, encouragement, radiation yung treatment, chemo, mga ate, baka po may pwede tayong gawin. Tapos yung second part ng question kay ate, ninenervyos ako. Yung baka raw po pwede yung palliative and, what do you call that? Hospice care, extend po sa mahihirap kung may bayad po ba yun. Yung first question po muna. Marami pong salamat.
Okay. Ma'am, may I know where do you live? Ortigas. Okay. This is exactly what Doc Mae and I are campaigning for, that we want to establish compassionate communities, one LGU at a time. Because when we are able to establish, diba, we will map that community kasi. Like, sino ba yung palliative specialist na nandyan? Sino ba yung NGO support group na nandyan? LGU, ganyan. Kasi once we're able to form that network, which is also aligned with the universal healthcare, the healthcare provider network, di ba? Isasama na natin yan because once that is in place, then we will be able to address your need. And I was just in consultation yesterday with people from AIM, and they're thinking of that app that you were talking about. And and sila Doc Joanna Sabal, who's also a palliative specialist, they had the Zoom meeting with me and they were running ideas through me, and I said, that is what we need, that app. So I will tell them na validated yung inyong project. So
And then I always keep saying last, but ito na last from me. I started way back 20 years serving as a palliative and hospice care provider with Ayala Alabang Hospice. We went to the poorest of the poor in Muntinlupa. Bumabiyahe kami with a tricycle going into the alleys and over the water there, patients having colostomy bags that were makeshift. That's where I started, and then after I was with the hospital, the Asian, I saw the gap, and that's precisely why we have to lobby and push for national implementation through the LGUs. We have to connect, and it's something, it's in the law. So we need to make sure that the programs of the LGUs are, because of that practice, we set up a foundation that serves those who are needy through home care, palliative, and hospice care. Over the past 10 years, we were able to move in the city of Muntinlupa, train their nurses, and now the LGU has a community-based palliative care team. So it took a while, but that's how, we just keep on keeping on. They have a responsibility, but advocacy groups will help in setting this up. And that's the task of also of Hospice Philippines, to empower advocacy groups and NGOs to also move with their LGU.
Thank you. Okay, so what my takeaway from the two of them, I don't know if that is what your takeaway is to build compassionate communities. Diba? Alam nilang ginagawa nila both of them Pero alam ba nung mga taong gagawa noon sa community? Do they have that compassionate community spirit? And it's not to destroy the claim of one senator who used the word compassionate, which is malasakit. No? I mean, are you comfortable using that word? Because it is malasakit. I mean, if you know your neighbor and he needs something, you will go there regardless of whoever is laying claim and wants to be able to give all the ayuda for you and own it. I mean, that's another thing. But the compassionate community, to me, is my takeaway. It is easy to do. It is the easiest thing to do. You will just have to know the family of your caregivers, the people who work with you, and the people you go to office with. And dun lang mabubuo na nyo kung anong tulong ang maibibigay. And I was telling Doctora here, sabi ko, if we were to create a series on television, do we address ourselves just to government? Or do we address ourselves to the community and to individuals like you on what you can do? Because the usual conflict is, tinitira natin yung gobyerno, hindi nyo ginagawa yung trabaho nyo, and the discussion ends. But if we are able to equip ourselves with that compassion, continuity, and stay on with the LGU, because the LGU, are they having barangay elections? Yeah, so... No. You have to know that the LGU is there. The barangay health worker is your key. If you want to have somebody arrested for child abuse, you go to the barangay. So yun yung barangay, kailangan chika-chika tayo. Chika-chika, Sarah, boss, pag meron kayong kailangan, and then you visit them regularly, they are your eyes and ears. And you have to join the visitation in the community with the barangay health officer. That is the compassionate community, yung 90% na gusto nyong habulin. Huwag tayong mas magaling sa kanila because sila yung nandun sa baba eh. Alam nila yung mga problema nila eh. So if we do not listen to them and we do not find out, Kap, ano pong gagawin natin? Pwede ho tayong sabay pumunta dun sa bahay ni somebody para tulungan. It'll reduce the 90%. Diba? Ano sa palagay nyo? Kung hindi kayo naniniwala, okay lang. Pero you try. Yung compassionate community is the key. Because kaya natin, ang babait natin eh. Are we not a good people? We want to do good and we do good. Diba? So yun ang tandaan nyo. And I'm ending my thank you so much.